I'm Nicole Shecker, manager for the Clinique de Paris, DHI Philippines, or direct hair implantation. So today we're going to be entertaining some questions coming from interested patients, questions coming from our website, Facebook, Instagram, and through emails. So let's start with the first question. Our first question is from Jamie Poblador, coming from Facebook. How do I know if I need a hair transplant? Well, Jamie, thanks for sending in your question. Well, you would know first if you would need a hair transplant if just, on your own, you look at yourself in the mirror, you feel that your hair is flat. When you see yourself in photos, your hair is looking very thin. I think that is the first step. But alopecia is a medical condition and you should seek expert advice. Now, there is a medical chart called the Ludwig scale, which measures female pattern baldness in a scale of 1 to 3. So that is where it starts central thinning at the top of the head and spreading out towards the side. When you have that and you are assessed by an expert, you would know that you have a medical condition called alopecia. And that is a time that you can consider having a hair transplant. So our question for today is from Bernadette Season from Instagram. Masakit ba ang hair transplant? Okay, Bernadette, actually hindi siya masakit. Because we use local anesthesia and the protocols that we practice ensure that everything is done safely with minimal discomfort. So I can assure you there's no pain. Our next question is from Odette Jonicio from Facebook. How long will a hair transplant take? And pwede bang outpatient ito? Thank you, Odette, for your question. The hair transplant for women is really just in one day. So usually we start about 10 o'clock in the morning, finish after 6 to 8 hours. And the procedure goes by very fast, especially for the patient. In the morning we do the extraction, we categorize the hair, and the most important part is also doing the hairline design. Then in the afternoon, we start with the implantation phase, and voila, we're ready to go home. Some patients fly in the night before the procedure and fly out the next day after the procedure. So yes, the procedure is just done in one day. Okay, so here we have another question from Tina Riley via email. Do I have to shave my head for the procedure? Other clinics say I need to go bald, and this is a deal breaker for me. Hi Tina, definitely I know what you're talking about because I wouldn't do this myself. Here at DHI, we do a very discreet haircut for the ladies. You won't have to go bald. Very subtle. Right after the procedure, you can't even tell you had a transplant. So we have one more question here from Jane Rivera via WhatsApp. Magkano po ba ang hair transplant? Well, the treatment packages for hair transplant vary from case to case. It really depends on your goals and your expectations. More so, let's say if your goal was to have like thicker hair in the middle, lower your hairline, looking back 10 to 20 years younger, the treatment varies. So it's really best that you come by the clinic so we can assess you. Rest assured, whatever the treatment plan is, the quality of the transplant you get is the same all throughout. Here's another question from Emily Ramirez sent via Viber. How long will it take for results to show? You will start seeing results come 4th month. Your hair becomes thicker and more dense, and you will see the results in 1 year. So last question for the day is from Nancy Cosgayon. I'm not going bald, but I want my hairline changed. Can you help me? Well, there are 3 things we can do actually. One is for feminine hairline. We usually have a rounded hairline where we put the softer hairs to give it a nice shape. For a naturally high hairline, we can bring it down to add proportion to the face. And for some, we can also add a widow's peak, which visually divides a big forehead. So that's our last question for today. We'd like to invite you to ask us any questions. You can send it through all platforms, email, Instagram, Facebook, send us a text message or call us, or better yet, come by the clinic and come for